Here's a sample of what you'll hear on this episode of Natural Health Matters.
Science evolves, right?
Sure.
Right. Look at what we're going through now with this pandemic, right? We're always finding new information. Like I remember in the beginning, all these asymptomatic spreaders are the people they're causing all the problems, right? And then a very large study, 10 million subjects, was published from the one of the greatest peer-reviewed journals ever, which is the Journal of Nature. Mm-hmm. And they found out that asymptomatic transmission does not occur.
Wow.
It's so unbelievably rare. It's like 0.00001. It was some preposterously low number, right?
So somebody had a theory and a hypothesis, but they never bothered to check it out. And it couldn't stand up to scrutiny.
Yeah, definitely did not stand up to scrutiny, I'll tell you that.
Welcome to the Natural Health Matters podcast, where it's all about maximizing your health potential so that you can pursue the abundant life more effectively. I'm your host, David Sandstrom, naturopathic doctor and biblical health coach, and this is episode number 62. This episode is brought to you by Nicetown Blackout Curtains. One of the most important things you can do for your health at all levels is improve the quality of your sleep. And perhaps the most effective thing you can do to improve your sleep is to darken your room. God designed us to be awake and alert during daylight hours and drowsy at night when it's dark out. Do what I did. Install some Nicetown Blackout Curtains in your bedroom. Nicetown makes beautiful, affordable, quality blackout curtains that you can install yourself in a few minutes. Go to my website, davidsandstrom.com/resources, and click on the Nicetown affiliate link and start enjoying all the health benefits of improved sleep in a dark room the way God intended. Well, if you've been following along with the podcast, you know that we're going through a series on the spiritual component to health. We're going to take a break from that this week, and we're going to talk with a sleep expert. His name is Dr. David Shirazi. He's got a ton of education and a boatload of wisdom, and he really unloads on us in this conversation I had about how we can get a better night's sleep. So I really enjoyed this conversation, and I think you're going to really enjoy this episode. So let's jump right into my conversation with Dr. David Shirazi. Today we have on the show Dr. David Shirazi. He is a dentist. He has a master's degree in Oriental medicine. He's a licensed acupuncturist. Dr. Shirazi is the director of TMJ and Sleep Therapy Center of Los Angeles, which are state-of-the-art private practices limited to the treatment of TMD, craniofacial pain, sleep breathing disorders, and craniomandibular orthopedics. Dr. Shirazi, welcome to the show.
Thank you for having me, David. Thank you.
I'm excited to have you on because what we're going to be talking about is really important to a lot of people. Most of the people listening to this show, The Natural Nation, they know how important a good night's sleep is. But that is oftentimes easier said than done. There's a lot of things that can get in the way of a good night's sleep, and you are a sleep expert. So I'm excited to have you on the show and talk about some of the things that can obstruct a good night's sleep. Over 90% of the people suffering from sleep apnea are totally unaware of it.
That's correct.
So how do you know if you have sleep apnea?
Honestly, the only true way to know is from an overnight sleep study, whether it's in a lab or in your own home. They have these ambulatory home sleep tests that you just put on your body, put on your finger, put on a nasal cannula, you put it on yourself, and then you push a button. You go to bed, and then you wake up and you push the button and it turns off. And wow. believe it or not, we actually get really good data from that.
Is that right? Mm-hmm. Wow. Do you rent the device or do you have to buy it, or how do you get one?
No, so it's a one night study. So, in my practice, we're called fee for service. So people pay for the treatment first, and then we bill it for them. Some sleep labs will offer it as well. And they're often, they take insurance, especially Medicare. The challenging bit with sleep labs, this is a generalization. I'm sure they don't all do this. But a problem we've been having, at least here in California, is, there's very little profit margin in a home sleep study because the insurance just basically rapes the provider. I'm sorry for that, for lack of a better word. They just way underpay for a home sleep study. But they want to pay for a home sleep study because they don't want to pay for an in-lab sleep study.
Right.
Now, if someone prefers an in-home study, which is absolutely fine by me, The issue sometimes, the go around that some labs do is they'll do the home sleep study and they'll say, oh, it was really inconclusive, and we should really do it in the lab. Right.
Okay.
And it is true. You get much better results in a lab in terms of, because you get much more data, but it is an unusual place to sleep. So I have my own sleep lab. So and I offer home sleep studies. So I actually ask patients. So when you go to a hotel, when you're vacationing, are you the kind of person that as soon as you put the head on the pillow, you go straight to sleep? Or you need a couple of days to kind of get used to your hotel room and, all the linens and the cushions and all that. And if they say the latter, like it takes them a while, I go, well, we should probably do a home sleep study. It's going to be a bit more organic.
Yeah, yeah.
If they say, you know what, as anywhere I lay my head down, I'm asleep. Like my wife, I joke that my wife can sleep on a bed of nails on her face after 2 cups of coffee. Like she has no problem sleeping. Those people would do best in a lab. They would do great in a lab setting.
Yeah. So the advantage of the lab is they have the better equipment, but the disadvantage is it's an unfamiliar environment.
It is, and a lot of people don't like it. And that's kind of a problem. So to allude to your earlier question of, how can we know if we have sleep apnea? So, often it starts with, well, a bed partner tells me that I snore or I hold my breath.
Yeah.
Or they'll wake themselves up gasping. Right. Mm-hmm. But the truth is you could have 400 of those gasping episodes at night and not know a single one.
Wow.
Because you're unconscious. You're in your sleep.
That is amazing. That's incredible.
Right. So what happens is I see this in my patients. Sometimes people come to my lab because they just want the home sleep study. That's the reason why they come. Uh-huh. And they've been given the runaround so many times.
Yeah.
And one of the things that I hear often is I'm afraid to tell my doctor that I snore or have sleep apnea because he's going to make me do an overnight study and he's going to make me wear a CPAP.
Right.
Right.
Yep.
And that I just hear that so often.
Well, I'm an airline pilot, a full-time airline pilot. And a couple of years ago, I fly for a big airline out of Atlanta, Georgia. Been with them 30 years. And a couple of years ago, maybe 4 or 5, the FAA had a big push on sleep apnea for pilots. And if you exceeded the BMI plus a certain percentage, they automatically required a sleep study. They said, we want to know. We want to know.
I'm glad they did it. I've had pilots.
Because you may not know that you have a problem. And we want to make sure, we have to pass a physical exam every 6 months. And, you want to know when you're buying a ticket on an airline, you're not buying a lottery ticket, you're buying an airline ticket, right?
And you want to survive.
Right. You want to live through it. So you want your pilot up there fresh and alert, right? So
you do. I'm sorry, you do.
Yeah, absolutely. Well, first off, why don't we define sleep apnea for some of the listeners?
Okay. We measure sleep apnea predominantly on 2 factors. One, we have an obstructed airway, like the upper pharyngeal airway is obstructed for 10 seconds or longer. And another is we have shallow breathing that causes our oxygen to dip 3% or more.
Okay.
And then we take all those events divided by the total number of hours you're actually asleep, and we come up with an index, a score.
Okay.
And for an adult white male, 5 or less an hour is considered within normal limits. 5 to 15 is mild, 15 to 30 is moderate, and anything over 30 is considered severe.
Okay. All right. So how does snoring fit into this, and why do people snore?
Yeah. So, there's lots of reasons: nasal obstruction, enlarged tongue, edema, excessive, fatty tissue among the throat, sleeping positions, bed positions. There's too much dander in the bedroom. They need an air filter. The bedroom is too dry. They need a humidifier, and their nose clogs up from the dryness, or they bleed from the dryness.
Yeah. And
they switch to mouth breathing. Mm-hmm. So there's a litany of reasons why people snore.
Does mouth breathing interfere with sleep?
Absolutely. Absolutely it does. All right. So, we have a couple of receptors for oxygen in our entire body, but we have several hundred receptors for CO2.
Wow.
And the body doesn't like redundancies and empty spaces and voids and unnecessary things. So
Right.
if we have an extreme amount of CO2 receptors, well, that must mean that CO2 is pretty darn important.
Sure.
Yeah.
Yeah.
And we do know, this is just basic physiology, that if our end-tidal CO2 is not within a range, right? So we want to be between 38 and 45 millimeters of mercury. If we're less than that, then the oxygen in our hemoglobin won't liberate.
Okay.
It'll just stay bound up. Our autonomic nervous system can shift from parasympathetic to sympathetic.
Yeah,
right?
that's never a good thing. Not
And
when you're
that's
trying to
never a
sleep,
good thing, especially when you're trying to sleep, right? Well, I mean, I'll tell you this, like the average truck driver, the last time I looked at the data, the average truck driver lived to be 64.
Wow.
Right? And here they are, they have a pretty sedentary lifestyle, right? They're sitting in a truck all day.
Yeah.
They, you know, a lot of them are overweight, a lot of them, you know, have snoring and sleep apnea. And they have to be vigilant while they drive, right? Because kind of like the same reasons you do as a pilot, you know, they got to watch out for other cars on the road. They got to watch out for getting tickets. You know, they have to be just on top of it. They have deadlines now. Everything has gone corporate.
Yeah.
You know, so time is of the essence.
Uh-huh.
And then, so they're in a sympathetic state sometimes. So then when they go to bed, they're supposed to get a repose. They're supposed to recover. But if you're choking 10 times an hour, 20 times, 30 times an hour, you're not getting a repose.
Right.
Right.
Just
and
real quick, let me explain for somebody that might be wondering. The parasympathetic we refer to as the rest and digest side of the autonomic nervous system. And the sympathetic is the fight or flight. So obviously we don't want to be in sympathetic when we're trying to sleep. It's obviously going to interfere with our sleep. So that is a big issue.
Yeah. And stroke is a very large cause of death in that demographic.
Is that right?
Yeah.
Why do you think that is?
Well, because of the sympathetic, you know.
The dominance, sympathetic dominance.
Yeah.
Okay.
Yeah. That would be a strong reason. I mean, it's everything we're saying about the subject is presumptive, but we know how physiology works.
Yeah.
Right. So we know that happens.
Wow. Interesting. Does someone's, the way their molars align or the way their palate is shaped, does that interfere with sleeping as well? Can that be a problem?
Well, yes, but we need to be a bit more specific in our definitions. So the palate is the roof of the mouth, but it's also the floor of the nose.
Okay.
So a child that was predominantly bottle fed, we often see that they have a very, very, very narrow maxilla. And that means they have a narrow nasal aperture, which causes them to have a higher voice and breathe through their mouth.
Interesting.
This is a problem.
Yeah. Another reason to breastfeed.
Another reason to breastfeed.
Added to
There's
the
so
list.
many.
Right.
There's so many. Well, when we look at skulls prior to the Industrial Revolution, well before the Industrial Revolution, they breastfed for 3 to 5 years. Everyone had very wide and flat palates, big turbinate space inside their nose, and very straight teeth. They even had room. They had plenty of room for all of their wisdom teeth.
Wow.
Yeah.
And that is not the case today. I have 2 kids in middle school right now, and almost everyone, I would say better than 80% of the kids that middle school age are wearing braces.
Yeah, that's not surprising. Yeah, with the soft diet and the lack of breastfeeding. Yeah.
Yeah. Mm-hmm.
Yeah.
So would you recommend if someone was having issues breathing or, with snoring or sleep apnea to consult with an orthodontist that may be able to prescribe some devices and or braces that could help with that or no?
Yes, but I put a little asterisk on that. Not all orthodontists have moved forward in acknowledging the importance of the airway in context to crowded teeth and malocclusion. So you want to work the buzzword is a functional orthodontist.
Okay.
Someone that, for example, that would expand your palate to make space.
Yeah.
And someone that would do it early, right? So if you have a kid that's like 8 and is crowded or 7 that's crowded teeth, you want to expand that child. And maybe they won't need braces later. You don't know.
Right.
But I will say this, the few times we can non-surgically cure sleep apnea is in children with palatal expansion.
Wow. So parents need to be proactive And if they see an issue,
they do. And unfortunately, a lot of the orthodontists are not giving the parents that information. Like they just don't know.
yeah,
It's not part of their curriculum to teach.
haven't been trained in it.
They haven't been trained in it. And this is the only profession. Forgive me. I mean, I do orthodontics in my practice, so I'm not anti-orthodontics.
Yes.
But I've never seen a more recalcitrant to change field of medicine more than that specialty.
Is that right? I never would have guessed that.
I've never seen anything like it. Oh my God, they're the worst.
Wow.
Science evolves, right? I mean,
Sure.
Right. I mean, look at what we're going through now with this pandemic,
Yeah.
right? We're always finding new information. Like I remember in the beginning, all these asymptomatic spreaders are the people they're causing all the problems, right?
Uh-huh.
And then a very large study, 10 million subjects, was published from the one of the greatest peer-reviewed journals ever, which is the Journal of Nature. Mm-hmm. And they found out that asymptomatic transmission does not occur.
Wow.
It's so unbelievably rare. It's like 0.00001. It was some preposterously low number, right?
So somebody had a theory and a hypothesis, but they never bothered to check it out. And it couldn't stand up to scrutiny.
Yeah, it definitely did not stand up to scrutiny, I'll tell you that.
Wow.
But science evolves, right? The point being is that science evolves.
Yeah.
And we find out new things, we try things, and we find out, that worked, but it didn't work for them. Why didn't it work for them? Well, what did work for them? Then you try to do bigger studies. And I will say this, unlike, let's say, a pharmaceutical company or a DME-based company, where after they do the research, they're going to sell a product at the end. When it comes to orthodontics, there isn't that much money to support the research because there's nothing to patent at the end of it. It's just a technique.
Right. That makes sense.
Right. Or really a product for that matter. I mean, people have patented, appliances, but we're talking, pennies to the dollar. We're not talking,
right.
Nothing to justify the investment. Yes, nothing to justify the investment. I mean, it costs hundreds of thousands of dollars to conduct these kinds of studies.
Yeah. Now, you mentioned that some orthodontists are recalcitrant in their position and reluctant to change.
I would say most.
You have a story about a friend of yours who had a master's in neuroscience who was reluctant to go after the root cause. He wanted to treat symptoms. Do you remember that story? You shared it on another podcast.
Master's in neuroscience.
He had master's in neuroscience, smart guy. And
no. He was a physician. Okay. And prior to being in medical school, he had a master's in neurology.
Okay.
And he was in his fourth year of medical school, very prestigious medical school.
Uh-huh.
And I asked him a very loaded question, like, so are they teaching you anything about diagnosis these days? It was a very loaded question because I kind of knew the answer.
Right.
And he said, but I was hopeful, right?
Yeah.
He says, oh my God, all I'm doing every day is case studies.
Uh-huh.
And I said, great. Give me an example of a case study. And he said, well, a patient came in. She had a constellation of symptoms. She was like 45. And we diagnosed hyperthyroidism. I said, okay, excellent. Why did she have hyperthyroidism? Right. And he had the blank look.
Blank stare. Deer in the headlights.
Total deer in the headlights. And I said, well, the patient didn't have hyperthyroidism 10 years ago. So why is she in your office today with hyperthyroidism? Again, blank look. And my wife's a pharmacist and she's like the yin to my yang. So she's like, Dave is asking about the origin of disease. And again, he had a blank look. So I just went into professor mode and I said, okay, so what are some of the known causes of hyperthyroidism? And he said, well, it could be genetic. I go, okay, less than 10%. What else? He goes, it could be iodine deficiency. I said, great. And his wife looked at me and said, well, what's the answer? I said, he just told me the answer. And he looked at me like I was crazy. He goes, iodine deficiency. I said, look, if the blood work shows she has hyperthyroidism, as well as the symptoms, and you know that iodine deficiency can cause hyperthyroidism, why wouldn't you test for it? Why wouldn't you try something conservative first, right?
Yeah. Because
the alternative is
to get her on Synthroid for the rest of her life.
You cut it out and you're on Synthroid for the rest of your life, right?
Yeah.
And I even went further. I said, listen, the thyroid hormone regulates the other hormones. So until they find that right magic number, she's going to be nuts.
Yeah.
She's going to be out of her mind because she's going to be in these hormone highs and lows. It's horrible.
Yeah.
It's absolutely horrible existence.
Right.
And I said, imagine if that's your wife. Would you like her to experience that? Or would you like to try something? If you could dodge this bullet, wouldn't you dodge?
Right.
So that was the end of the conversation. I haven't spoken to him much since.
Oh, that's a shame.
that was about over 10 years ago.
Oh, wow. Well, I think that's a really good story because, this is Natural Health Matters. And there's a time and a place for drugs and surgery. Absolutely. They can be life-saving, right?
My joke is if you get into a car accident or you have a heart attack, you don't walk into a homeopath's office.
Right. You go to the emergency.
You go to the emergency, you go to the hospital.
Exactly.
Yeah.
But we need to know how and when to use their services. Their services shine in the emergency room, but they're not so great. They lose their luster. That style of medicine loses its luster with chronic health challenges.
That's right.
Speaking of chronic health challenges, let's kind of circle back to the sleep issue. Why is sleep so important? I mean, we all know we need it and we love it, but why? What happens during sleep, and why is it so important?
And I don't mean this to be provocative. I'm being literal. Sleep is more important than diet and exercise. Okay. So we have 4 stages of sleep: stage 1, 2, 3, and REM. And in stage 3, which is called delta, that is where we get almost all of our growth hormone. Okay. Yep. So obviously we need growth hormone to grow, but after we're done growing, we need growth hormone to repair, physical repair. Okay. Yeah. And then REM is where we do not just our memory consolidation, but our mental and emotional resolution of conflict.
Yes.
Yeah.
It's huge.
So those 2 stages of, especially in these crazy times, those 2 stages of sleep are incredibly important.
Yep.
So, I hear these podcasts where they're talking about, well, if you intermittent fast and then you work out before you go to sleep and you do this, you can increase your growth hormone by like 0.15% or something like that. And that's like a win. And I'm like, try getting a good night's sleep first and see how much you get.
Well, it's funny talking about the COVID thing. I was having lunch with a friend of mine who's in the medical field. He's not a doctor, but he hangs out around doctors all day long. And I was talking about how there's things we can do to be proactive to increase our resilience and our resistance to COVID-19. And he said, Dave, there's nothing you can do but wear a mask. I said, do you really believe that? I mean, what about getting a good night's sleep?
Yeah.
When I get a poor night's sleep, that's when I'm vulnerable to coming down with a cold, right?
Yeah,
it weakens
totally
your
right.
immune. When you lose one night's sleep, you weaken your immune. So you say, well, you can't make those holistic changes overnight. Well, one night's sleep sounds like overnight to me. You know?
No, you're absolutely right. And even Fauci, who's gone every which way that you can think of in his narrative in the last year and a half, even I think he was maybe 60 Minutes, where he said he loads up on vitamin C and vitamin D himself as a great preventative. And we know that's a great preventative.
Sure.
We know it's a great preventative. It's documented.
Yeah, especially D.
Especially D. But C in particular, it's very interesting how C works because C is an antiseptic vitamin.
Yeah.
And it seems certain ones, it's like you need vitamin D for a myriad of things. It's an enzyme, it's a vitamin, it's a hormone.
Right.
It's used in your gut system, your brain, your heart. Like it is essential for life.
Yeah.
Okay. And so if you have a low amount of vitamin D, your chances of recovery from any upper respiratory illness is compromised.
Yeah.
And if you take mega doses of vitamin C, it will actually aid you in recovery, especially as you're going through it.
Yeah. No doubt that's true.
Yeah.
What are some of the things, if you're suffering with chronic sleep issues, what are some of the things that can manifest down the road? What are some of the symptoms you may present?
Oh my goodness. So many. I don't know one aspect of our physiological, mental, emotional health that is not either directly or indirectly caused by disturbed sleep.
Yeah.
Okay. And one thing I didn't mention is the specific problem. Remember I talked about delta and REM.
Yes.
So anything that kicks us out of those two, either of those two stages of sleep for 10 seconds or more is called an arousal, right?
Okay.
So snoring can kick us out, apnea can kick us out, a noisy bed partner, a barking dog, a street
noise. Yeah.
Very exactly. There's a lot of things that can kick us out of that. And we sometimes know it. Like sometimes if you leave a light on in the bathroom, but you go to sleep anyway, it's like you tell yourself, I'm fine. I'm just going to go to sleep. But pretty much in the middle of the night, you're going to wake up and turn it off because it's bugging you.
Yeah.
Okay. It's compromising your sleep. So with respect to sleep apnea, there is already solid research that shows type 2 diabetes, hypertension, stroke, depression and anxiety. I use the term caused by sleep apnea because when we find that segment of the population that has both apnea and those diseases, and then we treat with either CPAP or oral appliance therapy, which is my specialty, then we see a resolution in their type 2 diabetes or great improvement in their hypertension.
So that's a strong statement. So you're saying it's not just aggravated by sleep apnea, but it's actually caused by it.
Yeah, it's one of those few times for some reason, we're not allowed to say cause because there are other reasons people get hypertension.
Sure.
Right. But people that have both hypertension and sleep apnea, yeah, we see a tremendous improvement once we resolve their apnea for sure.
That's really great. That's what a great work you're doing.
Thank you.
So can you talk about some of the low-hanging fruit someone can employ to start getting a better night's sleep? What's some of the stuff people can do?
So, there is a whole aspect of that called sleep hygiene. So we want to sleep in a very dark room. And when I say dark, I mean even the little light from your, if you have, I haven't had a television in my bedroom. It's been a long time, maybe 15 years. It's been a very long time since I've had a television in my bedroom. But when we do, even when it's off, there's that little red light to kind of let you know it's in standby mode.
Yep.
Our phones should be at minimum on airplane mode.
Yes.
And more than 6 feet away.
Uh-huh.
They'll sometimes do their own thing in the middle of the night and the screen will light up.
But real quick, when I'm recording a podcast, once in a while, I'll set my phone down near my recording equipment and I listen back and say, what is all that static? And I realize, I had my phone too close to the recorder. It was the EMF was
the EMF
passing from device to device. And then you think about it, we're holding these things in our pockets all day long. And I see sometimes people putting in their shirt pocket near their central organs.
I see women stuffing it in their bra. And I tell them, please don't do that.
Can you think of a worse place to put that thing?
There is a worse place. I sometimes have gentlemen sitting in my chair and they'll put their phone in between their legs, to fall over. I'm like, please don't do that. There's a lot of cell replication going on there.
Yes.
So you have to watch out for that. Yeah.
Yeah.
So that's the big thing. Just cut down the EMF noise. Another thing you can do to cut down the EMF noise is either don't put the headboard of your bed, like where your head is, near electrical outlets.
Yeah.
Right. So you can either just disable them or you can just move your bed to a different location.
Yeah. I have a Gauss meter. They're cheap. You go to Home Depot, you can buy these things for $20. And I have a Gauss meter, and it's good to go around especially your bedroom, and find out you might have a hot wall. You might have a lot of wires in that one wall, and you might want to do some rearranging your furniture to get your headboard away from that wall.
I know your audience can't see that, but I found that as well. So I ripped the thermometer. I have a digital touchpad thermometer. I had to rip it off the wall and put something in instead.
It. We're audio only, but he has it looks like on the wall. It's not your standard thermostat hanging there on the wall. It looks
it's actually a little grounding tool I put on there.
Okay.
Just because it was still coming through.
Yeah. Okay. Excellent. That's good stuff.
Yeah.
Anything else? Any other low hanging fruit?
Yeah. So we want a cool temperature, 62 to 72. 68 is probably ideal. We have to create, if you will, a sacred space for sleep. So that means you only use your bedroom for sleeping and sex, not for eating, not for having arguments, not for,
Watching
anything
TV.
you can, watching TV, not for eating, not for any of that.
Yeah.
Not for like putting your laptop on your lap and doing your work.
Yeah.
Just find another nook in the house to do that stuff.
Mm-hmm. That's excellent. I wanted to ask you before we wrap up, there's a device that I've seen, and I actually use this thing. It's called a Sleep Hero, and it's a device that you put in your mouth, and it looks a little bit like a pacifier, and you create a suction on your tongue, and it pulls your tongue forward, and you sleep with this thing, and it helps with the snoring. Have you heard of those, and what are your thoughts on them?
Of course. So basically there's a bulb at the end. You squeeze the bulb, you stick your tongue in it, then you let go, and it creates a suction effect.
Exactly.
And pulls your tongue forward. I mean, it does work. I mean, it does pull your tongue from falling back, but your tongue is still attached to your mandible. So your mandible can still fall back.
Yes.
Right? And it can still close off the airway. I had one female patient a while back tell me that her tongue got very long when she did that, but I don't think that was a detriment. She would just stick out her tongue, and it was really, really long. I mean, listen, things that are reversible, I say we try things that are reversible before we try things that are irreversible. Right.
Yes, right.
One thing about the over-the-counter sleep apnea appliances, the issue with those are everyone kind of knows this and doesn't think twice about it, but they're disposable items, right? They disintegrate, then you throw them away and you get a new one, right?
Yeah.
The thing is, they don't disintegrate on the shelf at CVS. They disintegrate where it's 98.7 degrees and wet. So people are swallowing that material. Right.
Yeah.
Which it's hard to find that says BPA free, but if it doesn't have BPA, then what else does it have? Right. And that's a whole separate problem in and of itself.
Yeah.
So, for example, if you had to go away with a friend and you didn't want, and you snore and you haven't treated it yet, and you don't want to ruin everyone else's trip, go ahead and use it for that weekend. You're going on a camping trip, you're going on a fishing trip. Yeah, go ahead, man. Do it.
Yeah.
But it's not meant to be a long-term solution.
Yeah.
It's not.
Okay. All right. Very good. Thanks for sharing that. Here's something else I want to talk about. It's very common these days. People go to the drugstore and pick up some melatonin, and they're looking at maybe 3 milligrams that they're taking every day. Do you see a problem with that?
3 milligrams of melatonin. Okay. So I'm glad it's 3 milligrams at least. So the actual dosage are between 0.1 milligram up to 3 milligrams.
Okay.
Right. Anything that you take too much of that isn't a vitamin, your body will, or a mineral, your body will stop its own production or reduce its own production.
Right.
So daily uptake of melatonin is not recommended. Right. And, the people that I see that are taking like 20, they need 20 milligrams or something like that to fall asleep.
Wow.
We don't recommend that. That's what is given to people with Parkinson's. So it's way too much.
Yeah.
So for example, I've had nights where I just needed some sleep, and I didn't know if it was because of the melatonin factor. So I went ahead and took some melatonin. I even took the whole 3 milligrams, even though I don't usually take it. And, I got a decent night's sleep, and I go, you know what? I'm going to do it again tonight. Great. I did it 2 nights in a row. It will be at least 3 months before I do it again.
Yeah. Right.
And most likely 6 to 12 months before I need to do it again.
Yeah.
Right.
Yeah.
Usually based on travel. So what I do instead is I try to maximize my circadian rhythm to drop my cortisol and up my melatonin naturally. And I do that with those blue blockers. They're these orange glasses, right? So when it's dark outside, but of course you got the lights on at home, I plop on those blue blockers, and I do everything with them, whether I'm on my phone or I, talk with the wife in the kitchen with the lights on. That's what I'm doing.
Yeah, I use them too. When you first put them on, you notice the color, but after you've got them on for a few minutes, you just get used to it, and it's really
exactly right.
It doesn't bother you at all. Another way to boost melatonin production is to get some sunlight on your skin, especially in the morning.
Exactly right.
That'll prepare the body for melatonin production later in the evening when you want it. So another tip there.
I wholeheartedly agree and support that.
Excellent. All right. So, Dr. Shirazi, how can people get a hold of you if they want to talk to you or learn more?
The best way, if you'd like to schedule, is just go to our website, tmjla.com or tmjconejo.com. The HO sound is JO. Okay. So Conejo is the phonetic, right?
All right. And I'll put that in the links in the show notes if you have any trouble.
But easy. TMJLA is pretty easy to find.
Yes.
And, because my office is called the TMJ and Sleep Therapy Center of Conejo Valley.
Okay.
And and I have a second location, TMJ and Sleep Therapy Center of Los Angeles.
Okay.
And you can just look at that and say, this is what we're doing.
Excellent.
This is where we can make an appointment and find. I did a Google talk on YouTube. We have like 30 testimonial videos. There are things that you can do to learn more about it.
Excellent. All right, Dr. Shirazi, thank you so much for sharing your wisdom today.
That's been my sincere pleasure. Thanks for having me.
And don't forget, this episode is brought to you by Nicetown Blackout Curtains. Think of sleep as you would a nutrient, because it is. We should all be taking steps to improve the quality of our sleep. Why not start with some low-hanging fruit? No other investment gives you more bang for your buck than blackout curtains because God designed us to sleep when it's dark out. Go to my website, davidsandstrom.com/resources. Click on my affiliate link for Nicetown Blackout Curtains. And don't forget to buy the curtain rods I've curated there for you as well. When you make a purchase from one of my affiliates, you're also supporting the show financially. You won't pay any more, and I make a small commission. So thanks in advance for your support. For more, go to davidsandstrom.com. In the show notes for each episode, you'll find links to all the resources that were mentioned, as well as a full transcript with timestamps that you can download for free. In addition, I always include a content upgrade with each show, which is a free download that is designed to help you go deeper with that subject. Once again, thank you for listening, and I'll talk with you next week. Be blessed.